Gentamicin for injection is available in Jordan with 7 trade names. Paediatric with a concentration of 300,000 international units per. Other 2 trade names available is Minims Gentamicin with a concentration of 0.3% and Optigram with a concentration of 0.3%. We have Gentamicin Biochemy with a concentration of 80 mg per 2 ml and Ultragen trials with a concentration of 80 mg per 2 ml. For dosing, doses should be based on actual weight unless the patient has hydrops fetalis. Doses should be individualized based upon serum concentration monitoring. For dosing in neonatals, extended interval dosing strategies may vary by institution as a wide variety of dosing regimens have been studied. This schedule here shows the dosing in neonatals according to Lexicomp. We have to consider prolongation of dosing interval when co-administered with ibuprofen or indomethacin, or in neonates with a history of birth depression, birth hypoxia or asphyxia, or cyanotic congenital heart disease. In pediatrics, doses should be based on an estimate of ideal body weight. In morbidly obese children, and dosage requirements may best be estimated using a dosage weight of ideal body weight plus 0.4 multiplied by total body water minus ideal body water. Dosage should be individualized based upon serum concentration monitoring and general dosing for susceptible infection in infants and children. We have 2 types of dosing: conventional dosing and extended interval dosing. In conventional dosings, we give intramuscular or IV 2 to 2.5 mg per kilogram per dose every 8 hours. Some pediatric patients may require larger doses. And for extended interval disease dosing, we have weight-directed dosing or age-directed. In weight-directed, we give infants and children's IV 4.5 to 7.5 mg per kilogram per dose every 24 hours. And according to age-directed, we administer for infants and the children. For infants and children who have renal impairments, those adjustments have to be made. For patients with a GFR from 30 to 50 milliliter per minute per 1.73 square meter, we administer 2.5 mg per kilogram every 12 to 18 hours. For a patient with GFR 10 to 29 warnings and precautions. Hypersensitivity may occur, cross-sensitivity to other aminoglycosides. Nephrotoxicity, this is a US boxed warning. We have to discontinue treatment if signs of nephrotoxicity occur, and renal damage is usually reversible. adverse events that patients may complain of are gait instability, swelling, stomach upset, ototoxicity, rash, injection site reactions, kidney damage if trough concentration was greater than 2 mg per liter, and itching. Gentamicin drug-drug interactions for amphotericin B may enhance the nephrotoxic effect of aminoglycosides, so we have to monitor therapy. Cephalosporins also may enhance the nephrotoxic effect of aminoglycosides, and cephalosporins may decrease the serum concentration. For stability and storage, IV infusion solutions mixed in normal saline or dextrose 5 water are stable for 48 hours at room temperature and refrigeration. Store intact vials and premixed bags at 20 Celsius degrees to 25 Celsius degrees and protect from freezing. For diluting gentamicin, for intermittent intravenous administration, a single dose of gentamicin injection may be diluted in 0.9% sodium chloride injection or in 5% dextrose injection. The solution may be infused over a period of 1/2 to 2 hours. Gentamicin injection should not be physically premixed with other drugs, but should be administered separately in accordance with the recommended route of administration and dosage schedule. Parameters. These parameters have to be monitored: urinalysis, urine output, blood urine nitrogen, serum creatinine, peak and trough serum gentamicin concentrations, hearing test, especially for those at risk for ototoxicity or who will be receiving prolonged therapy longer than 2 weeks, CBC with differential. With conventional dosing, typically obtained serum concentration after the 3rd dose. Exceptions for earlier monitoring may include neonates or patients with rapidly changing renal function. With extended interval dosing, usually obtain serum concentration after 1st, 2nd, or 3rd dose. It's important to know that not all infants and children who receive aminoglycosides require monitoring of serum aminoglycoside concentrations. Indications for use of aminoglycoside serum concentration monitoring include treatment course more than 5 days, patients with decreased or changing renal function. Administration in IV, gentamicin may be diluted in normal saline or dextrose 5 water